Have you ever heard of hand, foot, and mouth disease? Perhaps the name itself brings to mind a peculiar image. This disease, often affecting children but not exclusive to them, is an infection that causes sores in the mouth and on the hands, feet, buttocks, and sometimes even the genitals. A similar infection known as herpes angina causes sores just in the mouth and throat. The major symptom of both these infections is the appearance of these sores, which can look like small spots, bumps, or blisters. They can make swallowing a painful ordeal, and the sores on hands and feet might be distressing as well. Both these diseases are caused by a virus that travels in body fluids of an infected person. Mucus from the nose, saliva, fluid from one of the sores, and even traces of bowel movements can contain this virus. The infectious nature of this disease is most potent during the first week of illness, but the virus can linger in the body for weeks or even months after the symptoms have disappeared. Diagnosis for this disease is usually straightforward. Doctors or nurses can often identify it by understanding the symptoms and conducting a physical exam. However, if a child is consuming less fluid than usual or seems to be getting worse, it's time to call the doctor. The infection itself is not directly treated, as it usually resolves on its own within about a week. However, to relieve pain, children may take non-prescription medicines such as acetaminophen or ibuprofen. Aspirin is a strict no-no for children under 18 due to the risk of a serious problem called Reyes syndrome. The painful sores in the mouth can deter children from eating or drinking, making hydration a priority. Cold foods like popsicles and ice cream can help to numb the pain. Soft foods like pudding and gelatin might be easier to swallow. Prevention of hand, foot, and mouth disease and herpes angina lies in good hygiene. Regular hand washing with soap and water, especially after using the bathroom, is crucial. Keeping the home clean and disinfecting surfaces that a child might touch can further prevent the spread of this infection. In summary, hand, foot, and mouth disease and herpes angina are viral infections causing painful sores in the mouth and sometimes on hands, feet, and other body parts. The disease spreads through body fluids and is most infectious during the first week of symptoms. Diagnosis is usually straightforward, and while the disease itself is not treated, pain relief medications can be used. Hydration is key due to the difficulty in swallowing, and prevention is achieved through good hygiene practices. So remember, wash those hands and keep surfaces clean to stay safe.